Up. Chronic back pain is among the most common medical conditions. Jill Selby suffered for years, thinking she had no choice. But the 75-year-old has just undergone a high-tech treatment that got her up and walking in just 4 hours. Sarah Stewart explains.
Jill Selby is in constant pain.
It's really tingling.
The most simple day-to-day tasks are a real struggle.
When it's bad, it's really bad. Depressing. It does really get you down.
Taking off her shoes, walking around her house or getting into a car all cause unbearable pain.
I try and swing both legs at the same time. And then once I'm in, I'm fine.
The 75-year-old has been battling chronic back pain for 10 years.
It is very frustrating because I've always been very active, been able to do things. And when it happens like this and it just slows you down and you begin to worry about the future and how it's going to be, yeah. So these are what
Jill takes daily painkillers to cope with the agony. Until now, she hadn't considered surgery because she couldn't handle the recovery times of 6 to 8 weeks.
My idea of surgery was that it would take some considerable time, it would be very invasive, and living by myself, I didn't think I could cope.
Gillian, hi. Dr Winder, come on in.
But a breakthrough treatment performed by neurosurgeon Mark Winder has changed Jill's mind.
It's a minimally invasive decompression of the lumbar spine, and it's set up for when there is narrowing of the spinal canal. This is looking from the front.
The operation takes just over an hour and incredibly has patients up walking 4 hours after surgery. They also leave hospital much sooner and have less chance of infection.
So we're able to operate through a tube in order to decompress the spine, which means there's less damage to the muscle.
Jill is having the operation done at St Luke's Hospital in Sydney's Potts Point.
You're about to go into surgery. How are you feeling?
I'm really quite nervous, but I'm hopeful.
This is Jill's spine. How bad does it look?
Look, it's quite severe, and I think you can see it right from the top here. There should be this white fluid surrounding it the whole way down. And you can see as you come down how clumped up all the nerve roots have become coming down through here.
During the surgery, a small incision will be made in the back. A tube is then positioned through the muscles to the affected area. The overlying bone is drilled and removed along with any soft tissue that's causing compression. This allows the spinal canal to be opened up, stopping compression of the nerve roots. Jill's operation starts just after 8 a.m. We're invited into the theatre to watch as Dr Winder fixes her back. The main differences between this procedure and traditional methods are the size of the incision and the level of trauma on the muscle. In the past, the muscle was stripped from the bone, whereas here the tube is passed between the muscle fibres, meaning the muscle is left intact and takes less time to repair. Jill has 2 problem spots, but this method allows both to be fixed through the same small cut.
And the advantage about this is you can just angle the tube down and then do that through the same incision.
After being in theatre and seeing what they've just done to Jill's back, it's hard to believe that in just 4 hours' time she'll be up and walking. But the surgeon says not only will she be walking, but she'll be doing it pain-free.
Jill is taken into recovery and then onto the ward, where we soon visit to check on her progress.
Hello.
Hello.
How are you?
Oh, really well. Look, I'm lying flat.
Fantastic. Just take your time there so you don't get...
She gets out of bed without a hint of pain and walks up the corridor straighter than she has in years.
No pain at all as you're walking?
No.
No?
I mean, you know, my leg feels terrific.
And it's not just walking on flat surfaces. Jill can already climb up and down the stairs.
How did that feel?
Terrific, just terrific. I can't get over it. I feel quite teary, actually. Yeah, no, it was marvellous. Marvellous. Thank you.
She also sits and stands without effort and can touch her feet without cringing.
Look at this. No problems? No problems at all, actually. And I could probably put my foot up and take my socket shoe off quite easily. So there you go. It all bends, it all works.
Just get those hands through to the target, mate. That's it.
The surgery isn't just restricted to seniors. Chris Malone, a footy coach at Sydney University, had his back operated on 8 weeks ago after injuring it at work.
Out of the corner of my eye, a ball came towards me. I literally just went to grab it, downloaded my right, and then my back gave way.
Like Jill, the 34-year-old was hesitant about someone operating that close to his spinal cord. But in the end, the pain was too much to bear.
I couldn't bend over, I couldn't sit down. I spent, I think, three and a half months standing or kneeling at my desk.
Chris also decided to have the surgery because of his 3 boys.
You know, 5 years old, 3 years old, 1 year old. I couldn't pick them up. They're wondering, why can't Dad give me a big cuddle? And
Chris has to wait another couple of weeks before he's allowed to run, but he's definitely on the mend. Like Jill, he's happy to have taken the plunge and encourages others to do the same.
Having felt the way I do and seeing the result, I think anybody would be worth looking into and seeing if they could do the same thing, save themselves an awful lot of pain and a lot of years perhaps too.
What a relief that would be. And for more information on that story, visit our website.